everybody! Dr. Eric Herman, the Guru Chiropractor, and official Team Ringdinger doctor, proud to represent for the Northeast of the United States. I serve New Jersey, New York, Pennsylvania. Sometimes a little bit more north, people come down. Sometimes a little bit more south, people come up. I'm here again for a video with another new patient, Mr. Sergio. How you doing, sir? Give me some of that.
Not too bad.
This guy's coming all the way up from Atlantic City, New Jersey, which is like, I used to go a lot for gambling. It's like 116 miles, give or take, right?
About that, yeah.
So like an hour and a half drive, hour, 20 minutes or so?
Almost 2 hours.
Almost 2 hours coming up. Maybe traffic on the turn. Oh, for this time on the Parkway, yeah, coming up. Well, I appreciate you taking the ride.
Right.
The average chiropractor only really gets from like 10 miles around their office. And that used to be me before I started doing the specialty.
Yeah.
So everybody who travels, although most people nowadays travel, we talked about it off camera, but I always let you know I appreciate the drive that you took the drive for me. And I'm going to do everything I can to make the drive worth it to help you.
I was looking for the best.
And you were what? And you found me, huh?
I was.
The other ones were too far to drive or fly.
No, there's no more.
Well, thank you. Let's talk a little bit about what's going on with you. You do have a herniation in your lower back, L5-S1.
Yes, I do.
Okay, but that area is not bothering you as much lately. You've had some other treatments. Yeah. You had some plasma treatment to accelerate the healing, and some other chiropractic too, right?
Yeah.
And that kind of calmed it down.
Calmed down a little bit.
Yeah.
But pain always come back.
Coming back there. But now you're feeling more discomfort and tightness more towards the upper lumbar spine.
Right.
I told you it's the transition area between the thoracic spine and the lumbar spine. They call it the thoracolumbar junction, right around L1, T12. And when I palpated it, yes, there's definitely a lot of pressure there, and it doesn't feel correct. It doesn't feel like it's aligned correctly, and it's not moving correctly. So basically your symptoms feel like they're more on the side in the muscles, right? You get a lot of tightness and sometimes pain. And it gets up to, when it's really severe, 7 or 8. But you said right now it's calm. It's only like 2 out of 10.
Correct.
But you get episodes where you're just doing something randomly, like a little random move, and it grabs you and everything goes, for a short period of time, and it kind of like stops you, and then it goes away quick.
Yes.
And I said, I've seen that before. It could be a sign that there's some things unstable in there, and the pain is sort of warning you, don't do any more of that because it could make it worse. Because I want to talk a little bit about it while we brought the subject up, because I've been thinking about this lately. Pain is usually not the main problem. Definitely pain is problematic for people because you suffer, it hurts and it makes you suffer and it limits you in what you can do. And and it's just not good. But usually if there's pain, there's something underlying causing the pain, right? Pain is more like an alarm most of the time to warn us that something's wrong, and to protect us and hopefully stop us from doing whatever we're doing to ourselves that is damaging to continue to do it, right? Like, for example, God forbid we didn't have any ability to feel pain and we stick our finger in a fire. Ouch! And pull away. That's protecting us from continuing to burn off our hand till we feel the nasty smell of burning flesh, and that's what warns us that there's a problem. Quickly get away from the pain to stop us from burning ourselves. That's an example, right? So yes, pain is problematic, but most of the time when you have pain, folks out there too, there's always something underlying that pain causing it. So I don't consider myself a pain treatment doctor, although I help thousands of people reduce the pain that they're having. But I don't treat the pain directly. I look for and try to find the underlying cause of the pain. And once I fix that, and the brain notices that there's no more need for the alarm, the body and the brain shuts off the pain when there's no need for the alarm. If there's still okay, one more thing. I feel like I'm getting a little talkative, but I want to make this point. the analogy that I use is if you have a fire, God forbid, right? If you have a fire burning and then you have the fire alarm going off, right? They're two different things. The pain is more like the fire alarm, but not the fire, right? You could take a pain pill. The pain pills shut off the pain, but they don't put out the fire.
Right.
So temporary, just to get the pain relief so you can live your life and not suffer, that's okay. But for long-term relief or long-term solution, it's not good because the fire's still burning. Do you understand what I'm trying to say?
Yeah.
So anyway, you do have a little pain and you get those catches, and I think that's your body trying to warn you to not continue to do the things you're doing because there's something not right in there, and if you continue to do that, it's going to make it worse and worse and worse. Yep. So today, I'm going to try to fix the mechanical problem in your spine, and hopefully if that gets more relieved and a little more stabilized, then the body will not need to give you that pain alarm as often, and hopefully so that will reduce. Does that make sense?
Yeah,
all right. Sorry, I went a little bit on a tangent there for lecturing. But I like to educate also. I believe a doctor's job is not just to treat, it's also to educate the patients on health and how to take better care of themselves and all that kind of thing. So I do a lot of that kind of stuff. Secondarily, you have some neck stress and a little bit of pain, but mostly tightness. That's kind of new. By the way, that's been going on in the lower back for about 2 to 3 years on and off, right?
Right.
The neck, you said, has only been about a week or so. Yeah. Something happened, and now it's, when you turn your neck both ways, it's tight. Yeah. And one side, I think, when you go to the left, it feels like it's pinching up there on the left side.
Yeah.
So that's the secondary problem that we're going to work on too. I did the health history and the full exam. It's safe to treat, and I definitely feel like it's worth it because I feel like what I do as far as treatment-wise I feel very confident it's going to be beneficial to you. So basically, I'm ready. Did I cover everything good, or did you want to say anything?
Everything is
I think I talked
covered,
I think I talked too much.
Yeah, everything's covered right now. So
all right.
I am ready.
So you ready to go?
I'm ready.
All right. Go boca bajo again, face down. Get your body nice and comfortable.
All right.
The first thing I always like to do with all my patients is a little bit of a massage just to kind of loosen up the muscles, warm up the muscles, and get some more blood flowing. So we're going to do a little massage first. Your job, just stay relaxed and let me know if anything I'm doing doesn't feel good, okay? That's it. I'll do the rest. That's what you're paying me for. Now, right about here is where that problem is. What does it feel like when the massage goes over it? Does it feel good? Does it make it feel more sore, more pain?
No, actually, right now it feels good.
Okay.
Yeah, the vibration, like release a little bit.
Tension.
Yeah.
Yeah, good, good, good. If it's too much for you, let me know. If you need less pressure, let me know. If you need more pressure,
No, it's about right.
gets rid of some of the tightness in the muscles. Good. Okay. All right, just a little warm up for the bigger stuff.
Okay.
Now, when you feel ready, go slow and easy and smooth. Come on up from here. Come up on your feet because we're going in the back room where the Ringdinger table is.
Okay.
Yeah. No fast or jerky movements are not good for you. So go smooth. Now, what I want you to do here is lay down, head here, face up.
Okay.
So, cabeza here, boca arriba. I'm practicing my Espanol. Now, the first thing, I'm just going to feel your hips because I have to line you up proper on the table.
Okay.
You're too high, so slide down like 3-4 inches. A little bit more. Right there. Good. Right there. Good. Now, you work on just getting relaxed. Okay. I'm raising up the table first. And then secondly, it's going to raise up your knees, which flattens out your lower back and makes it easier to release it. Good. Now the knees are coming up. Don't wiggle. Just let the table lift you.
Okay.
Let it bend though when it comes up. Good.
I feel like throwing out a baby.
Oh yeah? Wrong doctor. Now, I have to pin in really tight here above your hips.
Okay.
So it's going to be tight, just letting you know, but it's padded, see?
Okay.
It's got a good pad on there. Coming around. Good.
I'm nervous.
Yeah, a lot of people are nervous. Just try to keep breathing. Nice long breaths. This one might be a little tight. Can you handle this?
I have to.
Too bad, you're in. Now, let me have your hands back to me. This is not the treatment. I'm just making sure you're pinned evenly and there's no slack. Good. Oh, I got your wrist.
There you go.
No extra charge. Okay. Now the towel goes around your neck, but it doesn't choke. It's not on your throat. It grabs the back of your skull and your jaw like this.
Okay.
Okay. Let me get the towel going. Lift up your head and down. Just drop. Good. Now, your job, keep your teeth touching together, but don't bite too hard. Just keep it closed. So when I do a pull, you don't bang your teeth. Okay.
Okay.
And then stay as relaxed as you can in your body. The first thing I'm going to do is just stretch you. Not going to do a yank. I'm just going to stretch and do a little traction for about like 5 seconds. Then I'm going to let it go again. I want you to then we'll have you take a couple more breaths to relax even further. Then I'm going to stretch it again and do a little traction. Then I'm going to do a little pull, okay?
Gotcha.
So stay relaxed. Nothing big happening right now. We're just tractioning and loosening up your spine first, getting a little space in there, getting a little stretch. Feel how it stretches?
Okay.
Yeah. Just let your body stay as relaxed as you can while we're stretching. Relax your feet, relax your toes, relax your back, relax your body. All right, now we're letting it down. Good. Now take a deep breath. Inhale in, blow out all the tension. Let it all release. Good. One more time. Breathe in, inspiration, expiration.
He's every diver, so he knows.
All right. Now, we're gonna do another stretch, and then we're gonna do a little pull. Keep your teeth together. Stay loose. Let it stretch out. Let your whole body release. Good. Ew. Woo. Breathe. 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 Yeah. That was a big one, but a little pull.
It was a big one.
Yeah. Keep breathing. It'll pass if it's uncomfortable. Try to stay relaxed. Try not to clench your body.
Right.
Yep. Now, was that pain? Yeah. What part?
Everything.
Okay. Is it going away? Usually when people feel pain, it goes away pretty quickly. Keep breathing, keep staying relaxed. There we go. Now the smile is coming.
Yeah, but it's not going away. Whew, it might take a while.
Yeah, it takes a little while to calm down. Sometimes just breaking free that scar tissue and you get a little discomfort.
Watch
You're making me nervous. I'm watching to make sure you're okay. All right. I'm lowering the table while you're processing that. I went the wrong way.
Good.
I mean,
He's stuck. Yeah.
yeah, I talk better now.
Sometimes
Feel it.
it takes your breath away when you get released, depending on how much you react.
Can I stand up?
Not yet. Before you get up, I want to feel your neck and see if I need to do a little more release in your neck before we get you up. You okay with that?
It's coming back.
Yeah, good. Listen, I've done thousands and thousands of these.
Slowly coming back. Slowly.
Yep.
But it's coming back.
But don't get up too quick. You could just stay there for a couple more minutes.
I feel it in my chest.
Yeah, because we forgot to talk about that, but you also were experiencing some chest pain when you sneezed. Did it release like pop, or did it just start hurting, or what?
I felt the pop out.
Yeah.
From the lower back. You could hear it.
Yo.
From the lower back down, from the mid back down.
Yep.
It's coming back now.
Good. Good.
I was worried. Yeah, I could feel the crack from my lower back all the way down. I didn't expect that when you pull it, because you said we were gonna stretch, and after that.
Oh, you thought I was going to put you down and do a second one.
But you pull it right away.
Yeah.
I wasn't expecting that.
I was sneaky, sorry.
Yeah.
But the worst case problem is if you make tight right as I pull, that's not good either. So I have to be a little bit sneaky to keep you relaxed when I do the release. So you get a clean, good release.
I'm back now.
All right. Let me feel your neck. If I need to do a little more twist, you're okay, right?
Okay, yeah.
Because I want to make sure your neck. Drop it in my hands. Let it
Oh, yeah, stand up.
relax.
Oh, man.
Nice.
There you go.
Be nice. No cursing. We have a PG YouTube channel, not a rated R.
I didn't complete the okay. I'm still
PG-13 only.
Yeah.
Now,
I feel good.
we're done here for now. When you feel ready now, come up, but easy. The best way before you come, turn sideways first, let your legs come off, and then push the rest of your body up with your elbow. Don't do a lot of bending. Try to kind of stay straight.
Yeah, I stood up like that for years.
If you need help, let me know.
No, I'm good. I'm good. Sorry.
They'll be bleeping that out on the editing.
It felt good. It felt good.
Yeah, good.
The
Good.
stretching, but was kind of tough at the beginning.
Yeah.
What 2 minutes?
Yeah.
And came back.
Good. That happens. You're not alone. Some people, I've had patients screaming for like 2 minutes straight after the pull. And that's a little nervous, but on the way out, they cry and kiss me because they feel better.
I'm going to kiss you.
No kissing.
Unless you want it, unless you tell me.
No, hug. How about a hug or a handshake? But now stop here when you're standing and evaluate how you feel now. Can you tell anything different? Do you feel different?
I feel different. A little. I feel taller.
All right, good. Hey.
I look taller. Right?
Yeah, good for you. No extra charge for the tall.
Thank you. Yeah, I breathe a little better.
Good.
Yes.
Bueno. Okay, good. Walk around a little bit too now. I want you to go back in here, maybe walk around once on the around the table. See how it feels walking, moving your body a little bit.
Feels lighter.
Good.
A little, yeah. Feels good.
All right, good.
It feels good.
You had a little rough minute or two after the pull, but it's happened before and it went away now, the pain? Like it subsided from the pull?
Yes. It went down because I still felt it when I came here.
Yeah.
A little. You know, I couldn't
2. It
handle
was a 2.
Yeah, it was pretty low. But now, actually, it's almost gone.
Amen.
Yeah.
Now, you're probably going to be sore for a couple days. But, there's a difference between soreness and pain.
Right.
The soreness is from the treatment itself, from breaking free the adhesions and, releasing things that are stuck. Mm-hmm. But guess what? We're only half done. We have more to do. So,
oh, shit. Well,
when you're ready, book a bajo, face down. Yeah.
Right.
Yeah.
Okay.
We're going to reassess a few things. We're running a little bit late.
Be gentle.
Well, you could pay extra. I'll guarantee the gentle. No, just kidding. So remember when I bent up your knees, you said it was pulling here, right?
Yes.
I want to by the way, I'm just going to feel real quick. It does feel looser. Good. Yeah. I want to rebend and you tell me if it's pulling as same or less. Okay. Bend, bend, bend.
It pulls less, way less.
Good. I'm clapping his feet because I'm happy. That means you're making good progress. That's a good sign.
I could feel it.
Yeah. Okay. Now we're going to do more treatment with what's called the drop technique, the push down technique. So slide your body down a couple inches for better alignment. Good. Now I'm going to drop down. You good? Yeah. I'm going to drop down the belly because there's a trap door here to get more space in here for deeper release. Also, this is for pregnant women. I'm trained to treat all the way through the pregnancy. Now this is going to pop up hold on, I gotta tighten it. Who was on here before? Okay, and when I push down on you, it goes boom, okay? Just stay relaxed. Usually, the worst is over. The Ringdinger is the most intense part of the whole treatment. Good. Good. Much looser down below. Okay. Good. Good. Okay. We'll go a little more gentle. Hang on, I gotta tighten the tension a little more. You okay?
Yeah.
Good. 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 All right. I know it's sensitive, so I'm not doing a big thrust in that problematic area. Okay.
I think you pull everything out with this. You ain't gonna find too much over there.
Now we're gonna do more here. Boom, 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 boom.
Okay.
Stay relaxed. You okay?
Oh.
Good. Nice.
Right.
Now we're gonna do a little bit more in the neck and upper back, yeah. Good. Nice. Still tight here?
A little bit, but it's way better with the Ringdinger.
Yeah. That literally could have pulled out decades of stress in one pull. Look up a little bit. Just stretch this way. Just stay relaxed. Let it go. Let it go. Good. Little bit of pop there. Good. Now it's good. Now it's better. Okay. Now I want you to roll over on your back. Boca arriba. Por favor. Por favor.
Okay. Well, it feels bad.
Good. And that's what I was just going to ask you, how it feels when you're moving around. That's a good sign, because when your back is jacked up, moving around and getting up and down is not easy, right?
Yeah.
So it feels better. Good. Slide down a little bit towards your feet, right there. Now we're going to work on the front a little bit. Release the collarbones and a little bit in the front ribs, a little more. Is this sore when I push? No? So we're going to do a little release here. I'll try one, make sure you're okay, and then if it's yes, we'll do a little more. Bring your arms out like this. Okay, stay there.
Oh, shit.
That's just the table setting. Good. That was your AC joint. This is your SC joint. Actually, you know what? This looks like it needs to come up a little bit. Good. Okay. Now we do the AC joint here. Good. SC. Good. A little bit here in the ribs. You okay? Good. Good. Okay. Relax your hands wherever you're comfortable. I'm done up that way. Now we're going to do a little knee pull here. Boom. To release the knee and maybe more in the hip. Just give me a loose leg. Loose, heavy, floppy. Drop it in my hands. Let it go here. Let it release in my hand. Good. Nice. Slide back up. I'm going to call you potty mouth from now on. Now we're going to do, you okay, pop the toes?
Yeah, I do everything.
Good. Now we're going to do a little tug at the ankle. Relax, relax. Let it go here. Oh, mas. Big release in the ankle.
Oh, yeah. I feel it.
Yeah. Now we do the same thing here.
Right.
Knee first, toes and ankle. Drop it loose, loose. Let it go. Drop it in my hand. Oh, big release in the knee. Did you hear it? I think they heard that in Colombia.
Oh, yeah.
They're like, earthquake? No.
My mom
No,
heard
just Sergio in New Jersey getting adjusted.
I'm going to sleep with the baby.
You might. Relax. Good. Let it go. Good. Okay. Now we're going to do the shoulders a little.
Okay.
Let me see. Slide down again more. Right there. Table pops up. Bend your elbow. Stay relaxed.
Oh.
Let it go here. Good. Other side. Relax, relax, relax. Good. Okay. Done on this table. So when you feel ready, come on back up. Notice how it feels getting up. And we're going to eventually get you sitting on the stool again. Take your time. Go slow and smooth.
Feels good.
Feel looser.
Yeah.
More relaxed.
Yeah.
Less pain.
Less pain.
All right.
Less pain in my
Good
back.
job.
Less pain in my
That's
back.
good. Those are the 3 things I look for positive outcomes after we're not 100% done. We're almost done. So come here, sit here, face this way. The only thing we're going to do left, we're going to do a little bit releasing your elbows, a little bit in your wrist, fingers, and then we'll be done. Yeah, I could work with it. Drop it down, heavy, heavy. Let it go, loose. Good. Now we will do the wrist. Relax, relax. Pull back a little bit. Pull back towards you. Pull. Good. Good. Pull. Good.
I'll do my fingers all the time.
Yeah. Now we do the other side. Drop it in my hands, heavy. Good. Nothing there. Let it go. Pop. Good. Ooh, that was nice. Pull. Boom. Bang. Bing. Bop. Boom. Done.
All right. All right.
All right. Done with the visit.
That was good.
My impression and my measurements told me you did very well.
It was good.
Is that all you need? I don't know. That's the honest truth. We have to wait a few days to see how the body heals and then how you feel after it heals.
Okay.
So my instructions for you after the visit is take it easy for a few days with keep your activities that usually make this worse. Okay. Keep it minimal if you can. If you feel sore, which I really think you're going to probably have some soreness, ice. Put applied ice on wherever the sore spot is for like 20 minutes on, 40 minutes off, and then repeat as much as you need. It'll help speed up the healing and reduce the inflammation and the swelling. Okay?
Gotcha.
After 2 or 3 days, make your final decision on how this feels. If you notice, yes, this felt like it helps me, but not all the way, like there's still something I still want to make better, then my best recommendation is come back for a follow-up within a week or 2 is my best recommendation if you can and you're willing to keep the momentum going in the right direction. If you wait too long to come back, you will have a little backsliding and lose some of the results. If you can't, you can't. And, it's not the end of the world. Usually the patients don't lose every result, but some. So if you're really gung-ho and you want to keep going forward as quickly as possible, come back in 1 week or 2 weeks and we'll keep doing more treatments.
Okay.
So you said the pain went from a 2 to a 0?
Almost, yeah.
Yeah?
Almost gone.
Good. That's very promising. How about the neck? Turn the neck a little bit.
My neck, I can turn it. I feel like I can turn it better now. I still feel a little bit of tension right here, but not crazy. Not
but
bad.
reduced and good.
It
All right. Sometimes as it heals, it'll even feel better.
Okay.
But if it doesn't, come back in a couple weeks and we'll do more and we'll get you better.
All right.
Even further.
Yeah.
All right. Anything else you want to say? Or I think you did very well. Thank you for trusting me.
Thank you.
Let's say goodbye to my fans out there. We'll close it out. So, Big Sergio, doing a lot better. Had a good first Ringdinger.
I'm here with the best.
I thought I had to call the paramedics right after the pull, but no, he survived.
Yeah.
No, he did good. I'm just messing around.
Good.
He did really well. And if you're watching this video and you're like, I have problems too, and that looks like something that could help me, go with your instincts, go with your gut. And if you're within the tri-state area and you're willing to come to central New Jersey, I'm in Edison, New Jersey. A lot of people are driving 2, 3, 4 hours now. That's kind of routine for me. I'm not bragging, but that's just what's so. Because of my specialty, there's not that many Ringdinger doctors in the Northeast. It's me, and there's another guy certified in Manhattan, and then there's one guy in Massachusetts. And really, that's it for certified Ringdinger doctors for the Northeast of the country. So if you're willing to take the drive, I promise you I'll do my very best to help you like I did with this guy. The best way to reach me is my website, guruchiropractor.com. It's probably on the screen. Go to the website. It's got all the information you probably needed to answer any questions that you might have. However, if you want have more questions, just reach out to my assistant, Zach. You could text him 908-224-3080, or you could click the book now button on my website, put the information in, he gets it, and he'll reach out to you. And then you guys work out questions, and he'll help you book an appointment if you decide you want to come through. And if you come through, I promise you I'll do my best, again, like I did with this guy. I love and appreciate everybody out there. God bless you. Out.